Connected by purpose, driven by passion. Welcome to the Spark Live webinar series, where we gather to curate, convene, and showcase excellence and innovation from across the child and youth healthcare community. Our goal is to spark conversation, ideas, and action. Children's Healthcare Canada would like to thank our funding partners for their ongoing contributions that support all of our programs and activities. Keep up to date on all of Children's Healthcare Canada's webinars, events, and announcements. Sign up for our Spark News e-bulletin by visiting our website at childhealthcan.ca and follow @childhealthcan on Instagram, X, and LinkedIn. Now, on to today's webinar.
Hello, everyone, and welcome to another edition of Children's Healthcare Canada's Spark Live webinar series. I'm Paula Robeson, your host for the next hour. I'll begin by acknowledging that Children's Healthcare Canada operates on the traditional and unceded territory of the Algonquin and Anishinaabe peoples. We recognize and deeply appreciate their historic connection to Ottawa. And today, Ottawa is home to Indigenous peoples from across Turtle Island. Children's Healthcare Canada is committed to forging new and deepening existing relationships with First Nations, Inuit, and Métis people. We are grateful for the opportunity to share this land as we work to measurably improve children's health and healthcare from coast to coast to coast across Canada. We're delighted today to be speaking with our colleagues from Holland Bloorview, Dr. Melanie Penner, Saebom Park, and Gabriela Masri Amar. Gabrielle Masri Amar, who will be presenting on Autism Diagnosis and Care, Insights from Canadian Community Physicians. I'd like to briefly introduce our speakers for today. For more fulsome bios on these wonderful folks, please visit our website at childrenshealthcarecanada.ca. Dr. Melanie Penner is a senior clinical scientist and developmental pediatrician at Holland Bloorview Kids Rehabilitation Hospital and Bloorview Children's Hospital Foundation. She's a research chair in developmental pediatrics. Dr. Penner's clinical and research interests are in autism, specifically in service delivery for this population, including evaluating the impact of new care models. Dr. Penner has certainly undertaken research and educational work to expand Ontario's diagnostic capacity for autism in the community, decreasing wait times and facilitating earlier access to essential therapy programs. Dr. Penner is the lead investigator on the Echo Audio Autism Diagnosis and Integrated Care Opportunities study, which Children's Healthcare Canada is pleased to support via its Spark Impact program. Saebom Park is a PhD student at the Institute of Medical Science at the University of Toronto and has been working alongside Dr. Penner on the Echo Audio study with a focus on analyzing data related to healthcare providers' experiences in providing integrated ongoing care to their autistic patients across Canada. And Gabriela Amar is an undergraduate student entering the 4th year of the Honors Integrated Science program at McMaster University. Gabriela has been working alongside Dr. Penner on the Echo Audio study with a focus on analyzing data related to the experiences of healthcare providers as well. And she's specifically highlighting the associated barriers and facilitators. So I see you've responded to the questions. I want to thank you so much and welcome all. It's my pleasure now to pass the mic over to Dr. Penner.
Thanks so much, Paula. And I want to echo the fact that CHC has been a wonderful partner in this work. And it is great that we have this community across Canada. So we're going to be talking about autism diagnosis and care. And from the first phase of our Echo Audio study, which I will explain a bit more, but insights that we got from interviewing pediatricians and other healthcare professionals across Canada. Gabriela and Saebom do not have disclosures. I do have a couple paid consulting disclosures previously with Roche and the province of Nova Scotia. I've done a bit of medical legal work None of these are directly related to what we're going to talk about today. We've had a land acknowledgement already, but I will say just that as we go forward in doing work and in thinking about making autism diagnosis and care better for everyone in Canada on these lands, we need to be mindful of truth and reconciliation, of the harms that have been done in the past, but also how partnering with First Nations, Métis, and Inuit communities can help us to build a better future going forward. Okay, so new to the outline segment, we're calling Autism in the News. That was just added. And then we'll get to our regularly scheduled program. I'll give a review of this thing we call Echo Autism. I'll talk about the Echo Audio study and the importance of implementation science in this approach. And then I'm going to turn it over to my brilliant co-presenters who will talk about what we've learned about diagnosis and integrated ongoing care across Canada. And then some key takeaways and next steps, hopefully some time for questions as well. We would love to hear from you. Beep, 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 beep. Okay, autism in the news. So I couldn't help but start this with probably my favorite meme that I found. You might have heard that there's a rumor that the Amish don't have autism. I come from a Mennonite background. I come from a long line of quilters, and I really loved this meme. Okay. You've probably, if you have been around anything playing news this week, have heard that there's from the US been a very forceful claim made that acetaminophen causes autism if taken in pregnancy, or actually the claim has extended to if given in the early years to, babies and toddlers. We have a lot of correction to do on this misinformation. Acetaminophen remains the safest medication that you can take during pregnancy for pain and fever. And there are risks to pregnant people and to their babies from leaving fevers untreated. And some of these associations are clearly linked with neurodevelopmental effects. There is a JAMA 2024 very high quality study from Sweden on almost 2.5 million kids looking at whether this association between acetaminophen and autism exists. These things are very, very hard to study. But this was probably the best done study on this to date. And notably, they had a small association at the start, but when they factored in siblings, like the fact that autism runs in families, that association disappeared. So very important message. If you are a healthcare provider, if you are a pregnant person, if you are a parent, if you are anyone, the current state of the literature does not provide a basis for changing our recommendations during pregnancy. And in fact, the Society of Obstetricians and Gynecologists of Canada just put out a statement with that same conclusion. Another thing that you might have heard about was leucovorin. And so I've been hearing about this a lot over the past 6 months or so. This was also mentioned in the US press conference on Monday. So the idea of using leucovorin as a medication to treat autism is based on the idea that some autistic children have difficulty getting cerebral folate or getting the nutrient folate into their brains. And leucovorin is a medication that helps to bypass that. There was a 2018 randomized control trial that used a bit of an unusual outcome measure that was a combined version of a couple different language outcomes that reported benefits in children's language development. However, other measures of language did not improve. And really important to know, despite the study being cited a lot, when I went to look on clinicaltrials.gov last week, I learned that this study was actually terminated for non-compliance by the FDA in the US. So these are not results that I'm actually able to even say should have been published. However, there was a CBS News segment in February 2025, which seemed to kick off the hype around this. There was an uncritical presentation of the results with the author of this study who said things like, "We have done the science," in support of giving leucovorin to autistic children. Now, that's not the only study that has been done. There is a randomized control trial from India published in 2024 that showed a statistically significant, but notably clinically smaller benefit, didn't have any of the same outcome measures as the original study. So in the case of leucovorin, there is potential here, but we really, really need more study to actually understand and to be able to make informed recommendations for families. I'm not even going to talk about the claims made about vaccines on Monday, because that is beneath me and it is beneath you to keep hearing it. So some key messages to take out. Acetaminophen is the safest medication we have in pregnancy to treat fever and pain. Acetaminophen is safe for babies and young children. Our current vaccine schedule is safe and in no way related to autism. Leucovorin may be helpful. Likely, if it is, it's probably going to be for a subset of autistic children, and we really need more evidence to understand this. And frankly, pregnant people and autistic people deserve so much better than they have received this week. And so, I really, it's disheartening that we have again found a way to put the onus for autism on mothers, which is a recurrent trope over time. One of the heartening things of this week is that you will see that children's health organizations, autism organizations, groups of physicians and other types of clinicians are united in our responses to some of this damaging messaging that has come out. And that's enough about that. Okay, what is ECHO? So on to things that I love to talk about. ECHO stands for Extension of Community Healthcare Outcomes. It is a learning and community of practice platform that began in New Mexico, so different place, and for a really different clinical question, which was how to bring good care to people with hepatitis C living in rural areas. It has been adapted for many different conditions, including autism, and we are happy to provide that in Ontario. So to give you an idea about our ECHO Ontario Autism program, we run it on Zoom every 2 weeks for our physician and nurse practitioner group, weekly for our group of psychologists. And we have a hub team, and these are the folks who participate on our hub team here. I love these people. These are the best people you could possibly have to teach you about the different facets of autism. We have a physician, a psychologist, an occupational therapist, a board-certified behavior analyst, a social worker, and most importantly, we have autistic advocates and we have family leaders. Each session looks the same way because that's what ECHO tells us. That's what's been studied and proven in this model. So we do a welcome. We make everyone introduce themselves each time. We have a teaching or didactic presentation with some time for questions. But really, the bulk of the learning comes from case discussions. So we have presenters who are in the community bringing cases that they see in their real world practice. And then we all have an opportunity to discuss those together. We distribute our slides and recommendations to all the participants after that. Okay, so that's ECHO. Now, what is this thing that we're calling ECHO Audio? So Project ECHO Audio. So here audio stands for Autism Diagnosis and Integrated Care Opportunities. And sometimes I joke with my husband that I really decide that I'm going to take on a project once I come up with a clever name for it. So this is a 5-year project that's been funded by CIHR, and our goal is to spread and scale Echo Autism in Canada. We have 6 sites across Canada. This is awesome because when we started, there were 3 sites that were running Echo Autism programs. There were 2 that were interested in starting. And now we've actually added a 6th one. So we have Ontario, Nova Scotia, Alberta, British Columbia, Quebec, and Saskatchewan. And I hope that's not where we stop. Our goal with this project is to integrate 2 key elements of autism care into our ECHO training platforms across Canada. And those are a focus on how to do diagnosis in your practice, in the community, and how to provide really good ongoing integrated care. We decided to make our project plan like a subway map, inspired by the passionate interests in transit of many of our autistic clients and friends. And so I'll go over this quickly, but the phases of our project is, first, we want to check in with community providers across Canada at each of those sites that we mentioned and understand what helps or hinders them providing that autism care in their context. From there, we're going to analyze those data. That's what we're going to be talking about today. And then using it to kind of think about what are the ideas that cut across all of these experiences in Canada. What are the experiences that are unique to each site? And then develop a toolkit for each site to support those aspects of autism care. Then we want to look at the specific strategies that we can use to help implement those toolkits and evaluate the whole thing. So we're using implementation science approaches to help us do this. I am a fairly recent convert to the benefits of implementation science. So these are established frameworks that really help us consider all of the relevant factors in terms of what makes a new initiative more likely to succeed. And it also gives us a way to evaluate whether or not we succeeded. So that has been really helpful for us because I know for me, it's helped me to think about domains that I might have skipped over otherwise. This is the framework that we've been using, and I won't spend too long on this. I will say this is from the Center for Implementation, which provides some really awesome resources and training if you, like me, are interested in learning more about implementation science. So we build on a model called the Capability, Opportunity, Motivation, Behavior model. And then that is further broken down into something we call the Theoretical Domains Framework, or the TDF, into all of these different domains that can influence, again, whether a new initiative is successful or not in terms of its uptake and implementation. From there, what's cool is that the TDF is actually linked to different strategies. So for instance, say if we identify that knowledge is a gap in a particular area. So next slide. Then we can identify that and sort of expand it out and look at, okay, what are the different opportunities or ways we have to intervene to support knowledge. So this is the TDF provides us with a really well-structured way to go from what is a barrier to what is our linked action plan. Okay, so I'm going to turn it over to Gabriela to tell us about autism diagnosis.
Thank you so much, Dr. Penner. Yeah, so for the first objective, the focus was on the facilitators and the barriers that community healthcare providers face when conducting these autism diagnostic assessment. And we looked at this across 3 Canadian provinces, including Alberta, Ontario, and Nova Scotia. So to begin, I'll be discussing capability, which touches upon having the skills and the actual knowledge to perform these diagnoses. So focusing on that skills from our findings, this was a domain that we saw similar themes throughout the provinces. Participants shared that key skills that are important to complete these diagnoses include having a good understanding of child development, Being able to take a good history, so for instance, asking the right questions and being able to rephrase questions when needed, observational skills and interpreting behaviors, as well play-based assessments, which include administering these and also the interpretation of results, the ability to adapt, cultural competence, and giving families results and what comes after a diagnosis. As well, providers share that skill development came from personal interest, which is really interesting to see. Next is intention, which is under motivation. This domain focuses on the provider's plans regarding these assessments. Providers did share that they plan on continuing this work, but some share what they hope to focus on, while others share their limitations that may come up in the future. For instance, providers in Ontario shared that they wish to focus on early diagnosis due to funding timelines. In Alberta, the providers shared prioritizing ongoing reflection to ensure that they're still capable and they're able to provide the best care for their families. Finally, in Nova Scotia, the providers shared that they hope to keep doing these in the foreseeable future. Within motivation, we'll be moving into the reinforcement domain, which providers from different provinces brought up how financial compensation plays a role in completing these assessments. In Alberta, a provider shared, so now prolonged virtual consults or follow-up visits can be billed the same as in person. And then you can bill for your time. So you have like your base consult fee, and then if you spend more than half an hour, you bill another fee. And then if you exceed half an hour, for every 15 minutes, you get to bill another code for the 15 minutes. And in Ontario, a provider, when discussing incentives about doing this work, they shared, I would say it's not the money. It is absolutely not the money. Here we can see how financial compensation is not an incentive for some community pediatricians in some provinces, but it is for others. Still within the reinforcement domain, a sense of accomplishment can provide providers the incentive for community pediatricians to keep this work going. A provider from Nova Scotia shared, I love being able to provide a family with an answer. Yeah, like this feels very nice. It feels like something like really tangible that you can do for a family. Within motivation as well, we have the domain of emotion, which is really interesting to look into, as frustration was brought up throughout the different provinces, but it was often brought up in a different part of the diagnostic process. For instance, in Nova Scotia, a provider shared, these poor families had to wait for so long. And then as a clinician, I'm like, I don't have any current information about this child, and it's just frustrating. So then the family's exhausted. The relief to finally see someone. I'm trying not to feel frustrated because I don't have any current information. Then Alberta, a provider shared, when I refer, I'm usually referring because I haven't been able to sort it out myself, and that is a little bit frustrating. Finally, in Ontario, a provider shared, and then also the frustration and disappointment with the services around like going, okay, here's this diagnosis, this is all these things that we can do. Hang on, you have to wait 5 million years for XYZ. So frustration comes up a little bit different in the different provinces, but is not all rooted from the same place. Under opportunity, we have environmental context and resources with a focus on provincial variability. The belief statements showcase how providers in Ontario often brought up the wait times for an autism diagnosis and the resources that are long and they're still growing. In Alberta, partnerships with hospitals are important as they provide access to resources like report templates and they can enhance the credibility of their own reports. In Nova Scotia, due to records being kept as a paper-based system, it can be difficult for families to access these. And these belief statements kind of exhibit how each province has different external limitations. Additionally, still under opportunity, we have the domain of social influences, which kind of focuses on how providers rely on mentorship and networks such as the ECHO Autism, as well as community support and how it helps the providers feel confident in completing these diagnoses. Some providers also brought up how actually observing other colleagues and other professionals do these assessments can increase their understanding on how to conduct them themselves. Finally, the influences of local culture among peers about providing these assessments can be influential. A provider from Ontario shared their real-world mentorship application and how it was key for them. They shared, but I think that being able to do the assessments and diagnosis that was because of support in the community, like having training and having mentorship and having availability of people that I could learn from. I don't think I could have done it if I hadn't been able to watch other people doing it in the real world and getting a bit of feedback on my own ability to do these assessments. I think I would have been a really lot harder. They highlight the importance of mentorship and the impact it has on providers conducting these assessments and their confidence. I'll pass it on to Saebom.
All right, thanks, Gabriela. So I'll be going over some selected preliminary findings from Objective 2 of Echo Audio, where we explored community providers' barrier and facilitator beliefs about delivering ongoing integrated care. And I'll be focusing on some key findings that were shared across Alberta, BC, Ontario, and Nova Scotia. So starting off, we found that providers view ongoing integrated autism care as an unquestionable part of being a community pediatrician. As articulated by a participant from Alberta, everything else in that child's life may or may not be impacting their medical care. We provide that kind of integrative care for lots of different kids. It's what pediatricians do. That's what makes them unique compared to other physicians. So in doing this work, providers take on various roles, such as acting as a bridge, helping families get connected to services, providing resources for families, coordinating care, identifying and managing co-occurring conditions, as well as providing education, emotional support, encouragement, and empowerment for parents of autistic children. Unfortunately, due to all these different roles and different hats that they wear, we find that providers can experience uncertainty around their scope of responsibilities, and they find it challenging to set boundaries in terms of what they can and cannot take on. Moving on, we found that providers recognize that strong knowledge is key in delivering ongoing integrated care. And they really view knowledge as the foundation for their skills and confidence. More specifically, providers believe that having a good understanding of common co-occurring conditions and their management, the roles of different professionals and referral pathways, the provincial and local landscape of autism services and resources, and how to support autistic youth through transition to adulthood is important in ongoing autism care. Unfortunately, these important areas of knowledge also happen to be the areas in which providers felt that they were most lacking. And similarly, we found that while providers believe it's important to have the necessary skills and tools to manage co-occurring conditions and to support families, they find this challenging and report a need for more guidance. The areas in which providers felt they lacked skills in was related to managing some of the more complex or persistent behavioral challenges, such as sleep and feeding, helping autistic children and families identify, navigate, and evaluate goals, and supporting home and lifestyle management strategies. The lack of skills in these specific areas of autism care was also reflected in providers' lack of confidence in these corresponding areas. And generally speaking, we found that providers feel more confident and comfortable with the medical aspects of care compared to managing some of the behavioral or sensory challenges. Another key shared finding across the provinces was how providers believe that additional training opportunities, like Echo Autism, and support from more experienced colleagues are really necessary for developing the skills, confidence, and capacity to provide ongoing integrated care. Providers shared how they felt that residency didn't properly equip them to work with autistic children in community settings, and they noted the significance of having mentors, especially early on in doing this work. And providers also highlighted the value of both formal and informal interprofessional collaboration in enhancing their integrated care practices. And then lastly, we found that while providers experience intrinsic rewards such as enjoyment, satisfaction, learning, and growth, and feel that they can continue providing ongoing integrated care, They noted salient systemic barriers that really limit how optimistic they can feel about doing this work for the foreseeable future. So some of the system level barriers that we identified across the provinces included long wait lists and limited availability of healthcare and service providers, resource gaps for school-based supports, smaller communities, autistic adolescents, and multilingual services, billing structures and the associated time constraints, confidentiality rules, and siloed systems that limit communication, as well as a lack of reliable and centralized tools to navigate the constantly changing and confusing landscape of autism services and resources. And this frustration with the system is captured in this response from a participant who says, I mean, I know what to do. It's just more like, give me somewhere where they can go. It's just like, once you've done it, are they going to be helped? We're happy to do our part. So to summarize some of our key findings, we found that providers view ongoing integrated autism care as a key part of their role and responsibility as a community pediatrician. Providers note significant gaps in their knowledge, skills, and confidence in specific areas of ongoing integrated autism care and need more guidance, tools, and support in their practices. And finally, there are many system-level factors that act as barriers in ongoing integrated care for autistic children, and providers think that changes are really needed for them to continue doing their part. And then in terms of our next steps, we're just in the process of finishing up our interviews. And then with our finalized results, we'll be taking them to our diverse Echo Audio team to identify what's important and feasible to address. And then we'll be developing strategies based on our prioritized findings. And then just to give two quick examples, one key barrier that we identified was the knowledge, skill, and confidence gaps in managing the more complex co-occurring conditions. And one potential strategy that we could build on is developing some form of educational and instructional guide or manual with an audit and feedback component to help providers monitor and evaluate their skill development. And then another example is related to the lack of tools to navigate the service and resource landscape. One thing we could do is potentially partner with individuals who have local expertise to develop a comprehensive and up-to-date tool for providers to navigate services, as well as share accessible information and resources with families. And these two examples are actually related to the explicit strategies suggested by participants during our interviews. So we will definitely be taking their direct recommendations into account during our process of selecting and developing our change strategies. And over to Mel.
So I think some of my key takeaways, trying to synthesize at a bigger level of what we've learned about autism care in Canada. I think first of all, the value of these implementation frameworks, because I think we often hear things like more education is needed or more providers are needed or things like that. And I think the way that we're digging in on this by hearing things from the people on the ground doing this work is that we need to be able to pair really tailored and specific strategies to these different barriers that they are identifying. So just providing more autism education through medical school, for instance, is unlikely to address all of the things that we are hearing from pediatricians. So we are really going to be digging in on trying to figure out what the best strategies are, and that's both across Canada and then what is specific to each of these sites. The other piece, and I think we really found this more so in the diagnostic data, is that access to an autism diagnosis looks very, very different in different provinces across this country. And so here we need to really think about, okay, what can we do? What's relevant to do at a national level, but where do we need to work with each of our provincial partners to identify where those bottlenecks are, the things we can intervene on to make the access to autism diagnosis and ongoing care better. Another thing that really started to stand out to me is that sometimes we run into policy barriers. So there are actual documents, rules, and tools that are dictating how access to autism care plays out. But in other cases, this is really about shifting culture, shifting those, this is how we've always done it, ideas. And encouraging and supporting people to try something new so that we can expand access. And then finally, right, there are things we can address through our project, through something like Echo Autism, through research. And then there are things that are probably outside of the context of that. So for instance, I am not in control of billing codes in Nova Scotia. And so some of those things, again, we look to our really policy-oriented partners like Children's Healthcare Canada to say, here are some other important things that we found where we need to do more policy advocacy to help. So some of our next steps, as Saebom alluded to, so we are going to engage our broad team. And something I want to highlight with that is that we have two councils that are helping us in this work. One is a council entirely comprised of autistic advocates who too often have been left out of decisions about how care for autistic people will be designed and delivered. And then we also have a council of racialized or otherwise marginalized caregivers. Again, wanting to amplify those voices to make sure that we are designing inclusive and equitable systems. We want to identify and prioritize what are the most important barriers and then select those corresponding strategies from our implementation science framework to give us the best chance of doing something successful that will actually improve care on the ground. So we will develop toolkits for each site. We're going to implement those, and then we will evaluate to see if we actually succeeded in our mission. I added this slide this morning. So I'm happy to take questions about any parts of this work, but part of the lesson part of the message I want to leave you is that we need everybody in autism care right now. And I've never felt that more acutely than this week. So we need your voices, we need your support, we need inclusive approaches and strategies. We need to recognize the dignity of autistic people. We need to counter this harmful message at every opportunity that we get. So I'm thankful that we had that we set up this webinar months and months ago. We had no idea about the timing of it. But please, however you can support this work, autistic people need your help. And with that, maybe we can end our slides, and I'm happy to take questions.
Thank you so much to all of our speakers. I see our audience members have a lot of questions that have come in, and I'm just going to take a moment to get those sorted out. So you found there were many differences among provinces regarding what pediatricians said would support them in autism diagnosis. How do you develop supportive strategies that are adaptable and tailorable given this level of variety?
Yeah, Gabriela, do you want to start with that one?
I could totally start with that one. So as Dr. Penner kind of spoke about a little bit earlier, this is when a national approach might not be effective when supporting pediatricians across all the different provinces, as these strategies need to be developed with this variability in mind, and developing those strategies that are focused on these communities and specific to their limitations and what their barriers are. So at the same time, also keeping partners from these provinces and community engaged as we develop these strategies is really important throughout the process. So yeah, I think.
I might add that I think a plan for sustainability is really important to build in from the start. And so the toolkits that we make have to be living documents, because we know, right? Even I know in my clinical practice, organizations merge and they change their names, and all of a sudden things are out of date, right? And so I think the fact that we are trying to run this through the Echo Autism programs helps us in that sustainability part, because we have kind of these established programs that can maintain the accountability and responsibility for keeping those various resources up to date as well.
Wonderful, thank you. Corey asks, do you have any practices on engaging nonverbal self-advocates in evaluation or in research on your council, etc.?
This is a great question. You know, representation on our council was something that we've been grappling with, honestly, since the start. And so, like many autistic kind of advisory groups, we realized we had a lot of like university educated folks or people who were students in university. And we are still working to diversify that group. And it actually led us to do a scoping review, which hopefully we'll be able to present here and publish about what are the best practices for engaging autistic advocates in this kind of work. So, you know, we are a work in progress that way as well. There are certainly a lot of different strategies. There are guidelines called the Aspire Guidelines by Christina Nicolaitis. And, you know, some of the strategies are providing materials ahead of time to give people time to prepare. For non-speaking autistic advocates who use alternative communication strategies, that might allow them to pre-prepare some of their responses to be able to participate in real time. It's also important to offer opportunities for people to participate asynchronously as well. So thinking about the various modalities of participation is one of the strategies that sort of comes to mind off the top of my head.
There's been a number of requests for your slide deck, and with your permission, we can share them via the website.
Sure.
There's a few comments that have come in. Lots of thanks for addressing the issue right up front, as well as for the information you're sharing about Echo Audio. Andrea said, peers can offer a lot of this ongoing social and emotional support and sharing of resources that physicians and others can't take on. So a shout out for their family engagement team. And after a new diagnosis, they meet with all the families.
Love that.
And I'm not seeing any more questions. Oh, wait, here's one. Pediatricians sometimes feel they aren't equipped to provide integrated ongoing care for kids with for autistic children and youth. What's the optimal role for a pediatrician in that continuing ongoing care, and what can the system do to support them?
Saebom, do you want to take that one?
Yeah, so I think the different roles that we've identified in our interviews, they capture the essence of I think what we want pediatricians to offer for autistic children and families. One concept that we're integrating into this project is called the medical home, where essentially we would like pediatricians to offer care that's accessible, continuous, comprehensive, family-centered, coordinated, compassionate, and culturally effective. And those are sort of the components that are involved in delivering community-based care, in a high-quality community-based care. Yeah.
Thank you. Another question, Roxanne. How could we connect with Echo Audio groups mentioned in the various provinces, and she in particular would be interested in knowing who's working on this in Alberta.
Yeah, so the Alberta group is run out of Edmonton by Lonnie Swagenbaum and his colleagues there. So that is our Alberta partner. We are working on getting a website up and going. It's probably an overdue achievement milestone for us. But yes, that I think part of the aim of this project too is just to like be able to combine all of the rich knowledge and resources of these echo autism programs across Canada. So stay tuned for that.
Wonderful. On the similar note, others want to know the sites in their own provinces. I assume that's available on your website?
The website to be developed.
Oh, okay.
So I can say so. In Ontario, you can just Google Echo Ontario Autism. That will take you to our local site. We have observers from across the country, so you are also welcome to join us that way. Our Echo for Physicians is starting in 2 weeks, so we would love to have you. The one in Quebec is run out of McGill University. There is one in Nova Scotia that is linked with the IWK. We mentioned the one in Alberta. The BC one is just getting off the ground. And then our newest site is in Saskatchewan, run by Dr. Gita Wiebe, who is, if you've met her, just an absolute spitfire. She's awesome.
Shout out to Gita. She's on the call.
We love you, Gita. So yeah, those are our partners across Canada. And again, I would love more.
Wonderful. Thank you so much. That's the end of our time together. Oh, wait, now there's more questions. Never mind. I will continue on. Alifa says, thanks for an amazing presentation. I'm wondering if there have been any considerations or discussions between the provinces about how the funding model might impact diagnosis care now and in the long term.
Yeah, so I do think that there are, as when I talked about policies, there are definitely some policies in Canada that influence your access to the resulting funding and services. So the one that comes to mind, British Columbia, where there are stricter restrictions on what needs to be included in an autism diagnosis. I understand that they're piloting a new process. I do think as part of this and potentially as part of the work of the National Autism Network and the National Autism Strategy in Canada, one task related to that might be to consider how we create like a standard for what needs to be included in an autism diagnosis in Canada. And then that can hopefully provide a bit more heft as to what different provinces need to adopt. So there are definitely tremendous differences between the provinces right now. I don't know that there are truly haves and have-nots. I think everyone considers themselves a have-not when it comes to autism care. But when we work together, we can find smarter ways to organize the system.
Thank you. That is worthy of many more discussions and potentially a podcast mini-series when we get there. Abra has asked, how effective was the treatment modalities in your experience?
Yeah, that's something that could keep us here for the rest of the week. We have, there are a variety of different treatment modalities in autism. And I think even more important than that is there are the heterogeneity or the variability in how autism presents across the population is tremendous. And so as we're trying to evaluate all of that, it makes it really tricky to land on not just what works, but I think increasingly we're moving to questions of what works for whom. And so in this age, before we really have a solid answer to that, I think what's most important is working with families, deciding what your goals are. And Saebom mentioned, right, that goal setting discussions with families was something that pediatricians felt like they wanted more support in. But what are the goals, and what are the family's resources to be able to work on those goals with a variety of therapists? If you are hoping to learn more about that, there could be an Echo Autism in your area where you can dig in more on how to have those conversations with families as well.
And what looks to be our last question, unless anybody wants to poke more in, do you have recommendations for a minimal standard of what needs to be included for an autism diagnosis, or a recommendation for where to find that? And that's from Julie.
Hi, Julie. The Canadian Pediatric Society published guidelines in 2019. I was part of the committee that worked on those. But what I love about those guidelines is that it really builds in flexibility based on the presentation of the child. So we know that there are some children for whom the autism diagnosis is much easier to figure out, and those children don't need and certainly shouldn't be waiting for a very complex, multidisciplinary assessment. We want to make sure that they can get that answer and they can get it in a timely way, and ideally in their own community. But for cases that are more complex or nuanced in their presentation, there are other opportunities available. You can come see a developmental pediatrician, or you might need to be assessed by a team. And so that assessment should have for everyone, should include, a history that is focused on the features of autism, as well as identifying co-occurring conditions, including kind of other developmental conditions, medical conditions, mental health conditions. You need to observe the child, and you also need to interact with the child. And then you need to have a discussion with the family where you explain the diagnosis to them and help connect them to the next steps.
And there, somebody took me up on my kind offer. There's one last question. This Fizza is a peer navigator who's wondering what should the conversation with families look like with regard to the Tylenol or the acetaminophen and autism commentary, especially from communities who may be more inclined to believe those claims or shift the blame on themselves.
And that last bit just gets me, right? Because I think that is it. It's wild. I had clinic yesterday, and I already had a family, as we're going through that history, disclose to me about, the mother taking acetaminophen during pregnancy. So it was amazing how quickly that showed up in my clinic. I think whenever we're dealing with these things, it's important to try to unpack or address the emotions that are coming along with it, or what is driving that. Where did you hear that? How did that make you feel? What do your family members say? Because that's often a big source of some of that ideology floating around. I think we can, make state our claims clearly, but not in a way that leaves people feeling bullied, or that we haven't heard, like if they don't feel like we have heard their story. And again, I think that's where some of this comes from, right? Families who do not feel heard or understood in the healthcare system. So we need to address those emotional pieces. We need to make sure families know that we have heard their story, that we have understood as best we can where they're coming from, and then continue to support them across all of those domains going forward.
Yeah, that parental guilt is a constant phenomenon.
It sure is. Yeah.
And I too feel for those families in this set of discussions. So that's the end of our time together today. I want to thank Melanie and Saebom and Gabriela, for a fabulous presentation. Many kudos to you here in the chat, and we'll share those with you as well. And I'll tell you now a few other things that are coming up for us today. In the coming weeks and months to come, we'll be hosting a variety of webinars and podcasts. Spark Live webinars coming up on October 15th. We'll be hosting Gender Affirming Care for Youth, Essential Knowledge for Healthcare Providers with Dr. Daniel Metzger, and that has other elements of mis and disinformation and addressing myths associated with it. On October 29th, we'll host Easing Pain, Improving Lives, a New Pathway for Children with Neurological Impairments with Sharon Hugh, Stephanie Glegg, and Hal Seiden. And in case you missed it, last month's Spark Conversations podcast, we checked in with guest Lauren Etten to discuss a right-size model that works, learning from Ontario's pediatric cancer care. And Lauren is the executive director of POGO, the Pediatric Cancer Organization. On October 9th, we are releasing the latest edition of the Spark Conversation podcast series. Listen in as Dr. Catherine Smart discusses right-sizing children's health care and pediatric palliative care with guests Megan Wright and Denise Prail. And coming up on October 1st, we'll be releasing a report that Children's Healthcare Canada and Children's Health Hospital Foundations commissioned Deloitte to conduct the first national economic analysis of children's healthcare in Canada. The report will share its findings for childcare health systems and those that are stretched thin with children navigating undersized healthcare systems or systems not purpose-built for children, resulting in poor experiences and outcomes. And for every dollar invested in children's healthcare, it generates up to nearly 5-fold return on investment. Stay tuned for more details about the Thrive, the economic case for investing in children's health. And lastly, join us at the Hyatt Regency in Calgary on May 31st through to June 2nd for our annual conference taking place there. Love to see you. Can't wait to meet those I haven't met before. Registration will open early in 2026, but the call for abstracts is now open until October 20th. Check out the conference platform for more details. The conference platform is found there in the chat box. It's event.4waves.com, Child Health Can 2026, all one word, /pages for the details. It's always fabulous if you can watch live, as your questions and comments really enrich the discussion. But if you can't, the recordings of these sessions and related resources are made available after the fact on the website via the new member portal. Thanks again for joining us today. Thanks to our wonderful speakers for this fabulous presentation. And hopefully we'll see many of you back here soon. Bye for now.